Is your baby at risk of container baby syndrome? Wondering, what is that? Hi there, it's Neesha from Sydney Kids Physio. In today's video, we're jumping in to talk about container baby syndrome and the consequences of it. So, what is container baby syndrome? It's basically a term coined to refer to children who are constantly being contained in different seats, like car seats, strollers, baby walkers, jolly jumpers, baby bouncers, basically being contained all the time because perhaps they are the second child or the third child, and mom is constantly having to be on the go to get the older siblings to school, to childcare, or perhaps it could be a working mom trying to rush from place to place and no one else is there to look after the little one. So the little one's constantly being pushed around in a pram or taken in a car capsule to places all the time. The consequences of a baby who's constantly contained in a car seat or a pram or a stroller or baby walkers is that they tend to be at risk of delayed gross motor skills, simply because they're not spending enough time on their tummy to play on the floor. They don't have the freedom to move around, and so they're delayed in their gross motor skills. The second consequence is little ones tend to have a flattened head shape because they're always contained and lying on the back, and so the head gets flatter. And if they have torticollis, they tend to have the flattened spot off to the side, and that can cause their head shape to get really windswept and twisted over. The third condition that is often seen in container baby syndrome is torticollis. So that really is the fact that baby has a tight neck muscle, but because they're contained all the time, they cannot move around, or they're not being stretched out often because they're being transported all the time. So it gets worse, and you'll see baby have a head tilt or a head preference. And that is often in combination with plagiocephaly, which is a misshapen head. On top of that, kids who are kept in baby walkers or jolly jumper, there's an additional risk of either baby being toe walking because they're on the baby walker all the time, or a jolly jumper and they learn to go on their toes all the time. The other risk with baby walkers is they can fall off stairs or pull things onto their heads, causing head injury. So the truth is, baby walkers are the #1 cause for head injuries in children under 5 years old. So we don't want little ones in baby walkers or jolly jumpers, but the risk of delays of torticollis and plagiocephaly is increased in little ones who are constantly contained in car seats, strollers, prams, bouncers, because mom has to be on the go all the time. So if you feel that your child is displaying consequences of container baby syndrome, reach out and speak to one of our expert pediatric physiotherapists here at Sydney Kids Physio. Until next time, stay safe and have a beautiful day. Bye.